Dr. John Torres with NBC News. Dr. John here covering coronavirus headlines. You've probably heard over the past couple of days, getting a little deeper into those headlines and a better understanding of what exactly that story means, and particularly what it means for you and your loved ones, how it can help you get through this coronavirus pandemic and hopefully help all of us end the pandemic a bit earlier, and then answer questions that you might have. So if you have any questions, please send them our way. I love to answer the questions because that gets down to the information that you really want to know. But first, let's go over the headlines here. Number one, the number of cases are increasing across the country. Now, overall, if you remember a few months ago, the number, Dr. Fauci in particular, but other experts were saying we should get below 10,000 cases a day by the time we start hitting our flu season. Well, we're getting very close to our flu season. We never quite made it down that far. The lowest we got here in the United States was around 21,000, and then it started creeping up again, and then it started surging up. And right now, we're looking at around 40,000 cases a day. Recently, yesterday, cases around 33,000, I believe, 34,000, but they're averaging around 40,000 plus a day, and that number seems to be getting even higher, even more concerning, as Dr. Fauci said, is we're not in a good place right now, mainly because the numbers keep going up, and in particular, 26 states, over half the country, are showing a 5% increase in cases. That's over half the country. The concerning part is where it's happening. It's happening in the Midwest. It's happening in the West. And those cases are continuing to rise. Even places like New York City, which was hit very hard, as we know, back in March and April, got things better under control. They had a positivity rate under 1%. Well, now that positivity rate has creeped up above 100% or above 1%, and they've also seen an increase in cases. Granted, those numbers are much, much smaller than they were. A few hundred cases a day right now versus thousands of cases they had back in March and April timeframe. But the concerning thing is, will that trend keep going up? And that's what we're seeing across some of these states. Now, the states with record high averages, and the averages we're talking about are over a 7-day period. They looked at daily averages to kind of even out the bumps in the reporting. And what they found is Montana, South Dakota, Utah, Wisconsin, and Wyoming are showing record high averages. Again, record high averages. This is the end of September. We're heading into October. We thought what we saw back in April were going to be the highs, but now we're starting to see them again. The other side of the coin, there are some states that seem to be doing better, and these are the Sun Belt states. As a matter of fact, Florida decreased their cases by 15%, Arizona by 40%. Even California are showing modest decreases in cases. But the concerning thing is that once these cases start going down, you might get a duplication of what's happening in other parts of the country. In other words, people might start relaxing their guard a little bit. They might start reverting to older habits. And when they do, then the concern is those cases are going to start coming up, number one. Number two is we're starting to head into our cold months. And most of these coronaviruses, much like the flu virus, are more active in cold months. So that means they're around more. Number two, we actually move indoors in cold months. And so we tend to congregate more. And number three, in cold months, we tend to have more runny noses, more sniffles, more sneezing and coughing, which of course means this virus could spread as well. And so the message here for this story is essentially just realize that we can't let our guard down at this point. We need to keep doing those things to keep everybody safe, and particularly keep looking at those states that are increasing to make sure we get those cases under control. And in other states where they're not increasing at this point yet, try and prevent them from increasing. So that's number one. Number two, well, it turns out Antarctica is the only continent in the world that has not had coronavirus cases for one very particular reason. The continent shuts down during their winter, which is our summer. And so essentially what happens is in their springtime, in our springtime, which is their fall time, the continent shuts down. It gets iced over so much that airplanes cannot get in there, boats cannot get in there. And so essentially people get locked into the continent for months on end. I was in Antarctica a few years ago with the Air Force, and it's a very small, even though it's a huge continent, it's a very small community. McMurdo, the main one, and then you have some isolated communities, and you have the South Pole Research Station. Those are very small communities that are very, very isolated. When I was there, we actually had a few cases of the flu, and as the medical doctor on the continent, I was very concerned that the flu would spread like wildfire. Luckily, a lot of people had gotten vaccinated against the flu, so we were able to keep it under control. But here's the concerning thing. is now that they're starting to get into their spring and their summer, things are going to start opening up. They're going to be able to have an airfield, get airplanes in there, and so they're going to start transferring people. Those people that have been locked in for months on end are going to be able to get out of there, and the other researchers and workers are going to be able to get in and then rotate through. The concerning thing is some of those people will be coming in, they possibly could come in with coronavirus, and if coronavirus hits that continent, again, small, very isolated, but congregated populations, then it could spread like wildfire. So that's a big concern. So what are they doing? Well, right now what they're doing is they're quarantining people for 2 weeks before they go to Antarctica. Usually you end up home basing, you end up staging out of Christchurch, New Zealand. You get all your equipment there, and then you go to McMurdo. And then from McMurdo, you spend a few days there, and then you go to whatever station you need to go to. So what they're going to do is they're going to quarantine people at Christchurch for 14 days, get them to Antarctica, test them there, if needed, quarantine them there or isolate them there for 2 more weeks, and then get them to their stations. They're doing what they can to keep it under control, but they also have measures in place in case they start seeing some cases down there, how they can isolate people very, very quickly to keep it under control. Because again, you can imagine in these very congregated but isolated communities, a very small number of individuals, if coronavirus spreads through there, it could wipe out the communities. It could make it very, very difficult to do any of the things they need to do down there. But to date, Antarctica is the only continent in the world that does not have coronavirus and has not been affected by it. We'll keep our fingers crossed that it doesn't happen. And then the last thing I want to talk about is Halloween. Halloween is coming up in a little more than a month. It's a fantastic time for children, for adults, for everyone. Love Halloween, love the traditions. The CDC is coming out saying, okay, we need to be a little bit careful this Halloween because like most things, coronavirus, it's going to be different. We're in the midst of a pandemic, so things are going to be different this year. There have been some headlines saying that CDC has canceled coronavirus or canceled Halloween. They have not. Or CDC has canceled trick-or-treating. They have not to a certain extent, but what they've done instead is they have stratified activities you can do on Halloween by low risk, moderate risk, and higher risk. And here is what they're looking at. So for low risk activities, they're saying if you want to do things like carve pumpkins, decorate your own house or apartment, have a scavenger hunt in your local area where nobody else is involved except for people in your own house, virtual Halloween costume contest, things like that where you're still doing that social distancing, you're still wearing masks, you're still staying safe. Those are low-risk activities. Moderate risk, participating in one-way trick-or-treating where you get goodie bags that are lined up for families to grab and go while continuing to social distance. And so maybe at the end of the driveway or somewhere in the yard, and you know how sometimes if you're not there or you can't answer the door, people will put out a bucket of candy and say, hey, use the honor system, take some candy, leave some for others. Well, they're saying the same thing here. Have individually prepared goodies in bags that people can pick up, kids can pick up, so you can still get some of that flavor of trick-or-treating, but that's a moderate activity. And then they're saying for higher risk activities, traditional trick-or-treating, ding-dong, trick-or-treat, that kind of thing, it can be an issue. It's a high-risk activity because you're interacting very closely with other people who come to the door to give you candy or the children that are at the door waiting to get the candy or the treat. Attending costume parties that are indoors, children or adults, that could be a big issue. Going to indoor haunted houses, going on hay rides or tractor rides, those are things that they say are high-risk activities. So you need to think about this over Halloween, what you want to do. The main thing is to try and have fun. Be creative like we've talked about for the whole year. Be creative when it comes to doing these things, but do it with safety in mind. The social distancing, the wearing masks, lots of hand washing, and of course ventilate. Do things more outdoors than indoors. Open windows if you can. But what they're saying is, if you do these things where you can social distance, where you can wear a mask, those are low to moderate risk activities. If on the other hand, you're trying to get the old-fashioned trick-or-treating where you go door to door, that's more of a high-risk activity. Or if you have trick-or-treating parties, or Halloween parties, more of a high-risk activity. And so again, think about that as you're planning for Halloween, and particularly as you're planning for your kids for Halloween. Work with them, have them come up with creative ideas. That way, there's no surprises on Halloween that they can't do those things that they'd like to do in the past. So everyone, the main message here is to be safe. We will get back to Halloweens that we remember Might be next year, might be the year after, depends on how the pandemic goes. But again, the headlines we're talking about, number one, 26 states are seeing big increases in numbers of coronavirus, and some states are seeing, there's a few states seeing decrease in numbers, but the concern is even there because people might be letting their guard down, and we could get more numbers of coronavirus cases. And this is before we've even gotten to our cold months, where in the cold months we know coronavirus, or at least we think it's going to spread faster and more robustly than it has during the summer months. Number two, Antarctica, the only continent with no coronavirus. The concern is the staff, the members there, the workers there, the scientists are going to be switching out here pretty soon, but they're putting measures in place to try and minimize the chances of coronavirus getting to that continent because it could be devastating. And then number three, Halloween. You can go to the CDC and look up Halloween activities, and they'll walk you through what they consider low, moderate, and high-risk activities. Avoid the high risk, avoid the moderate risk for the most part. Look at the low-risk activities to keep you and your children safe during Halloween. Let me see if you have any questions now.
What happens if you work in a place that doesn't have windows? Are we at high risk?
So the question is, what happens if you work in a place that doesn't have windows? And if you look at most modern buildings, and they've done this for a very specific and a very good reason. A lot of times windows aren't able to be opened. And they've done this because they've sealed these buildings in. And a few weeks ago, I did a doc-to-doc with a Dr. Joseph Allen. He is one of the experts on ventilation systems in buildings, and he tends to call these sick buildings because these buildings were designed for climate in mind, trying to keep the environment controlled, which we need to do, but they weren't built to keep infections under control, which at the time was obviously not that big of a deal, even though people like him and scientists like him were saying, hey, we need to remember this. So if you have a building where you can't open the windows, then the ventilation system is extremely important, because the key here is to make sure that that air gets rotated. Indoor air gets rotated with outdoor air on a very regular basis and in a fast basis. So a couple things to look at. One, how often is that air getting recirculated? How often is that air getting exchanged for outside air? And what kind of filtration are you using? In big buildings, they use a HEPA filtration system, which is the best to use in the big building. The problem with HEPA filtration is it takes a big HVAC system, a powerful one, in order to pull air through those thick filters. So in most houses, in most residential areas, in most apartments, you're not going to have a HEPA filter. Instead, you're going to have what's called a MERV, M-E-R-V filter. And what Dr. Allen has talked about is having a MERV 13 or higher, 13 plus filter, because that'll give you essentially the equivalence of a HEPA filter, but your HVAC system in your normal house, your normal residence, can go ahead and pull air through there without much of a problem, without having to work too much and causing issues with the HVAC system. So if you cannot open windows, the main thing to think about is ventilation. How often are they exchanging that air? Are they recycling the air? How often they do that? And what kind of filter is in place there, and how often they change the filter? Those are the things that are going to keep you safe there. Of course, in the building, social distancing, anybody who's sick should stay home. Those are all the normal things that you need to cover regardless of where you are. But Dr. Allen and others are big advocates of saying, hey, let's go back to the standards we did in the early 1900s, when at that time they would make buildings specifically with infection control in mind. Of course, this is before vaccinations and antibiotics were around, so they had to do things like that. But he said, step forward to 2020, the pandemic has shown us that's something we need to look at going forward. We should not have buildings where we cannot open windows. But they have done the non-window opening buildings for a specific reason of helping the environment, helping save the environment, which is a huge thing and needs to be done. So hopefully we can merge those two and get buildings that are good for infection and good for the environment at the same time.
Is it possible to have COVID-19 but not yet show up on a test? I had strep throat, and this happened to me.
So the question is it's actually a very good question. Is it possible to have COVID-19 and it doesn't show up on a test? This person had strep throat, and same thing. I'm assuming she said the same thing, or he said the same thing didn't happen to them or happened to them. So I'm assuming they had a negative strep test, and then they were diagnosed with strep throat later. So let me walk you through what happens in a doctor's office when we take a strep test. So there are rapid tests, and there are tests that are longer term. The rapid tests, which are usually what we call antigen tests, usually you can get results in 15 minutes, but they're not nearly as accurate as the PCR tests. Those are the polymerase chain reaction tests. Those are the ones that amplify the DNA or the genetic material, and they look for that genetic material, but they take longer to do, as in a few days usually. So typically what happens, if you think about a strep throat, is somebody will typically, the doctor, the nurse, the med tech, will usually swab you with 2 different swabs. And they'll use one to do the rapid test. And that's when the doctor comes back in and says, you know, your strep test was negative, but your throat looks like strep throat. So I'm going to send out this other test and see if it's positive. And if it comes back positive, we'll put you on antibiotics. Well, the same thing with coronavirus. It's possible that you got one of the rapid tests, one of the antigen tests, which aren't as accurate as these PCR tests. So if you did that, it could be what we call a false negative. In other words, you have it, but you're not showing that you have it on that test. If you had the signs and symptoms for it, the recommendation is at that point to either go ahead and isolate you, say, you know, even though your test is negative, I think you have it, let's treat you like you have coronavirus, or to go ahead and get one of those PCR tests, the send out tests to verify it. And so hopefully they did one of those 2 things if you did come down with COVID. But it is possible to have COVID, have a negative test, especially one of those quick antigen tests, and again, still have the COVID test and the PCR test come out positive. So that's distinctly possible.
Will the vaccine be mandatory?
So will the vaccine be mandatory? And this is another great question that a lot of people are scratching their heads right now and putting their heads together to try and figure this out. Because if you look at the way vaccines work right now, there are some vaccines that are mandatory and there are some vaccines that are not mandatory. There are some areas where vaccines are mandatory and other areas where they're not. The example I can give you is the flu vaccine. So for the most part, the flu vaccine in hospitals is usually a mandatory vaccine, meaning that if you work in a hospital system, if you're a doctor, a nurse, a med tech, x-ray tech, whatever position you're in the hospital, then you need to have that flu vaccine. If you don't have that flu vaccine, then they take different measures depending on where the hospital system is and what part of the country and the unions and all that are involved in these decisions. In some places, they say if you don't get the vaccine test, you're not going to work here. In other places, they say if you don't get the vaccine, you're not going to work here. In other places, they say if you don't get the flu vaccine, then fine, but when you're here, you need to wear PPE. You need to wear a mask. You need to wear goggles. You need to wear that type of PPE to make sure you don't spread it to other people, because you can imagine, especially in a healthcare environment, that one of the worst things would be to have somebody there who's sick with the flu, for example, spreading it to other people. And so they want to make sure they're protecting the patients. That's the flu vaccine. With the coronavirus vaccine, nobody yet has figured out or has said what the requirements may be. And they're probably going to vary in different regions. If you work in a hospital system, it's probably going to be more mandatory than if you work in a different area. If you work in a school, it might be mandatory as well. And it might even get to the point where they say, hey, if you want to do this one thing, let's say you want to travel. If you want to go to a certain country, that country might very well say you need this vaccine to come into the country, much like they do in some areas with yellow fever vaccines. There are yellow fever vaccine requirements to get in certain countries. And so, again, we don't know yet, and they haven't made this decision. And my guess is they won't start making this decision until they get closer to the vaccine being available for the general public. And then I think you'll hear individual places popping up saying vaccine is mandatory if you want to come here. If you want to go to a football game, then you have to show us a sort of a vaccine passport to get in there. If you want to go to a concert, possibly. You can imagine where this could go with this. Nobody knows at this point yet, but my guess is some places will require it, other places won't require it. Some places might require it, and then the courts might shoot that down. It's anybody's guess as to this point. It'll play out, and I'll certainly keep my eye on this as time goes on.
Why are the rapid tests available and used if they can be inaccurate?
And this is a great question as well. The rapid tests are available and used, even though they're not as accurate as the PCR test, simply because they are rapid and they're very easy to do. Let me walk you through these tests. So the PCR tests, both of them, there's a variety of ways to get it, but let's assume the nasal swab. Both of them can use a nasal swab. So let's assume you get a nasal swab and you're getting the PCR, the more accurate test. You get this nasal swab, they send it to the lab. It usually takes, let's say you get it in the morning, today, Monday morning. Usually by Monday afternoon, Monday evening, it gets sent to the lab. It's in the lab overnight, then they start running it Tuesday. Maybe they'll start running it Wednesday because they want to batch these together. They want to make sure they're not running that machine just for one test. So they'll wait till they get a group of tests and then they'll run them through the machine. And so that might be Tuesday, it might be Wednesday, a couple days, then they report it back. So by then, you've gone 2 or 3 days waiting for the test results to come back. But it's a more accurate test result. Now the problem comes in is, what are you doing if you're trying to test a school, a nursing home? You're trying to test people before they get on an airplane like some airlines are talking about doing. How can you do that if you have to send off this test that's going to take hours or days to do. You can't. And so they've come up with these rapid tests. And the importance behind these rapid tests is they truly are rapid, even though they're not as accurate, but they serve as sort of a screening purpose. They serve as a purpose of finding out very quickly if you have it. And for the most part, when we're talking about sensitivities and specificities, the false negatives and the false positives, those are very small numbers. And so one test, the PCR test, might be 98% accurate. The antigen tests, the ones that aren't as accurate, might be 95% accurate or 92% accurate. So they're still going to catch the vast majority of people. They're just missing a few that the other tests might capture. And so overall, looking at the big picture, what you're looking at is quantity versus quality. So the quantity gives you the advantage of testing huge groups like a nursing home and testing them every day. And if you find people that are positive, saying, okay, let's get them out of here and get them isolated so they don't infect anybody else. That is easy to do versus the test it takes. You give them a test and you send it out 2 days later, and it's really hard to get that same control over the COVID cases if you're doing that. So again, they both have their utility, they both have their purposes. The one might not be as accurate, but it's much easier to do. It usually looks like a small card. And if you've ever seen the doctor's office, what I used to do is if I did a strep test or a flu test, those are those rapid tests, I would do the test, and if it came up positive, I would take it in the room and show the patient, hey, look right here, if you can see that line, that means it's positive, just to show them what the test looked like. At the same time, I tell them, you know, this isn't a sensitive, it came back negative, but I think you still have it based on your symptoms, and so we're going to go ahead and either treat you for it or send off another more reliable test just to make sure, but we need to have you stay at home for a couple days until that test comes back. So again, it just depends on how you're using it. There's usefulness in both of them, but you're right, one's not as accurate as the other. And so unfortunately, there's no one quick test that can be 100% accurate.
There's so much information on the pandemic out there. How do you know what is truth versus false?
And that's one of the big questions. How do you know what information to follow? And what I do is, and I encourage people to do, is use multiple sources. And so if you do find something, look at the source. Number one, is it a reliable source? For the most part, large universities, these research scientists that we've heard of, you know, Dr. Fauci, for example, these other ones that really look into the research and give us good examples and good rationale behind their reasons for talking about things and their reasons for telling us certain things is good. Number two, you can look at some of the government agencies. The CDC puts out very good information. The World Health Organization puts out very good information. The thing you have to realize is sometimes the CDC and World Health Organization give out information that on the level might seem like this contradictory, but if you look at it, the CDC is looking at U.S. specific information and U.S. specific advice. The World Health Organization is looking at information and advice in a global context. And so they might be talking about something they want people to do globally because people in developing countries don't have the resources they do here in the U.S. versus the CDC is saying, okay, here in the U.S., we have these resources, we can use them, so let's do it this way. So again, look at these different sites, but look at multiple sites to make sure that there's an agreement there. The one thing you don't want to do are get to these fringe sites on the internet and look at those and say, okay, that's the information. I heard this one headline or I heard half a headline. I want to go ahead and run with that and tell my friends about that. Make sure you do a little bit of research. And one thing is I try to give as accurate, scientific, data-driven information as I can. And I do Facebook Lives every Monday and every Friday. I do a doc-to-doc every Wednesday or Thursday where I interview an expert doctor somewhere across the globe to talk about coronavirus. So hopefully this is giving you information that you can trust because I look at multiple sources to make sure I'm giving you information that is scientifically sound, data-driven. And if that information changes, I'll explain why that information changes because things are changing as we go here because we're learning new things about coronavirus all the time. It's a tricky virus, it's a new virus, and we're learning a lot more information. But let me go over these headlines here again. Number one, states. For a while there, things were decreasing. We never quite got to the point we wanted to, which was 10,000 cases a day across the country. But those cases are now increasing, averaging around 40,000 plus cases a day across the country. 26 states are seeing rises in cases that are at least 5% rise in cases. The worst, Montana, South Dakota, Utah, Wisconsin, and Wyoming. Some states, Florida, Arizona, California, seem to be doing better, but they can't let their guard down. Antarctica, the only continent with no coronavirus, but they're about to change out their personnel because their winter is coming to a close, and so they're going to start opening up the continent again. So they're being very careful in how they're getting people in there, quarantine them before they get in there. And then Halloween. Again, the CDC is not saying don't have Halloween. They're not saying don't trick or treat. What they are saying is be careful, because there are low risk activities, moderate risk, and high risk activities. You can certainly go to cdc.gov to find their recommendations. But essentially what they're saying is if you can social distance, if you can wear masks, if you can keep away from other people, then that's going to be low to moderate risk versus knocking on the door, trying to get either, the trick-or-treater comes to the door, both people there are at higher risk of developing coronavirus, so you want to be careful. So again, the main thing is, for the rest of this week, you, your family, your loved ones, your community, I hope you have a fantastic week, and I hope, as always, that as best you can, you stay happy and you stay healthy.